Due to extreme inspiration and motivation, I wrote this poem entitled Orchitis, and I hope you
Nice.
would allow me to share it with you. I got a bad infesticle right on my left testicle.
What happens when three high school friends reunite during a Trump apocalypse? I'll tell you what happens. They do a podcast, little buddy.
The Torsion episode.
You are watching Generation Exile.
I'll start my little Storytime story now. Although it is brief, depending on interjections, and I'll leave the occasional hole wherever you see fit.
What are we fitting into your hole?
Well, I want to talk about a little situation I had a few months back. I woke up with extreme pain and soreness in my left testicle. I don't know if you gentlemen have ever suffered from any kind of discomfort or situation in that area, but let me tell you this, it's pretty attention grabbing. When your left nut is aching, sore, tender to the touch, obviously something's not right, so you got to take action.
Was it discolored?
No noticeable discoloring, but
Sorry,
just
okay, continue.
sore, tender as hell, and obviously not right, not normal. So immediate attention required. So I actually make an appointment that day with my GP. He's available, fortunately, so I don't have to go to an urgent care. And he's like, well, it could be a couple of things. The worst case scenario is it's a twisting of your testicle.
A torsion?
Torsion, thank you, Dave. Yes, that is the word. So that would require some imaging, and then to see whether or not a torsion is there. And then if it's not that, it's probably bacterial or viral.
What's
so?
worse?
Yeah, good question. Good question. So, Karen was with me at the time. She drove me to the doctor, and then fortunately, I was able to get the radiology done within the next couple hours, and then back to my GP.
Which specialist do you go to for the balls?
So I wasn't seeing a specialist at all for this. I was
General.
just seeing my GP.
Got it.
Not a urologist, not anything. And then I saw radiology. They did some imaging. And it gets back, and a few hours later, my GP's like, okay, good news. It's not a torsion. So we can probably treat this with antibiotics. So I said, okay, well, how did this happen? How did I get this? And he said, very simply, shit happens.
When shit happens, it doesn't go anywhere near the testicles.
It's not supposed to. It's not supposed to. And,
It depends how pendulous they are.
Like a flap backwards, a flap under.
Listen, gravity is a fickle mistress.
It's so true. It's so true. So I took a bunch of antibiotics, right? And
You're going with bacterial.
yeah, thinking it's bacterial. And within a day,
Can I ask a question here?
absolutely.
Did he give any indication as to what kind of infection this? Like, I don't know. Like you get a bacterial infection up here. It's strep throat.
Right.
What is it called in the scrote?
Well, that's the thing. It was really nondescript, and I'm sure there's a name for the bacteria, but yeah, that and the method of acquisition, remained a mystery because it's not like I'm
Right.
sexually promiscuous, and that it could have been a sexually transmitted thing.
Was it epididymitis?
Was it gonococcal urethritis or streptococcal balanitis?
Before I spill the technical bag here, it was orchitis, actually. So
Orchitis?
Orchitis.
I feel like I've ordered that at the Italian restaurant with some salsiccia.
Feel free
Orchitis con salsiccia.
feel free to Google that away because there's definitely a wordplay to be had here.
Right. Did you know that there's also a botanical term, orchitis?
Well, it does sound like orchid, doesn't it?
Gymnadenia orchitis, also known as the Himalayan fragrant orchid, is a species of orchid native to the Himalayas.
Wow.
Just FYI, that was the next one down from your ailment. But so you have no idea how you got this inflammation of the testicles.
Nope. But it did go away with antibiotics. And it was, knock on wood, never a problem again.
On a scale of 1 to 10, how painful was it?
So I'd say it was like a 4 to a 5 when I woke up with the soreness. Because, it's in such a tender spot that, even a 2 becomes a 4.
Did it hurt when you went to the bathroom?
No, I was not experiencing pain upon urination. I was, pooping normally.
Nobody asked. Thank you.
Yeah.
Well, you're welcome. Anyway.
The human body is so strange.
It is.
The human body is disgusting.
Yeah. I mean, just ailments come and, when I had a kidney stone, it may have been the most painful thing I've ever experienced, passing a stone. I rushed to the hospital, and appendicitis, I think, was the closest to that. Such pain.
Have you had appendicitis as well?
Yeah, it's absolutely. The body is disgusting, and we're sort of we're at an age now where things start to kind of go on the downward spiral.
Yeah, no kidding. Should be going broke all the time.
When I wake up in the morning, I cannot make a fist with this hand. It takes an hour or so before I can start bending my fingers all the way.
What is that from?
I don't know. I got to go to the doctor. It's not arthritis. I know that because I was tested for that a couple months ago on a different thing, and I was having like minor issues.
Right.
So, but we'll see.
You should. You know what you should do?
We'll find out.
Before you fix it, you should go to like a truck stop and arm wrestle Sylvester Stallone.
Yeah, that'll work. That'll work.
That is an over-the-top suggestion.
Yeah, it is over the top.
The good news is I was recovered within a couple days. Everything went on my merry way, and no negative repercussions that I'm aware of. But due to extreme inspiration and motivation, I wrote this poem entitled Orchitis. And I hope you would allow me to share it with you.
Sure.
It's written in the style of Shel Silverstein, if you're familiar with his work.
Yeah, love it.
So it's titled Orchitis. I got a bad infesticle right on my left testicle. The doc said, get some resticle, and I'll see you in a week. I said, I hate to be a pesticle, but please keep me abreasticle of any cure for this mesticle that just might cross your mind. A month passed, maybe lesticle, and feeling back at my besticle, I soon forgot about my testicle and was out having a ball. Doc called, go get dresticle. You must come see me nexticle. Some results came back on your testicle, and the outlook is not swell. Now I was depressical, but I played it close to the vesticle. I said, is this some gesticle? Doc said, yes, but don't go nuts. I did get a little testy with him, though.
There you go, brother.
Fiend.
I love it.
Bravo.
Yeah, I love it.
That was very Silverstein.
Thank you.
I believe from the collection where the urethra ends.
You beat me to it.
A light in the uterus.
You are watching Generation Exile.
Really hate that sad loser, Mr. Newberger.
Who, me?